From global superstar to fashion icon, Rihanna has been in the spotlight for 2 decades. But as her career has evolved, so has her appearance, sparking some speculation. Has Rihanna's facial transformation been purely natural, or could it be the result of plastic surgery? Let's dive in. In 2005, at the age of 17, we can see here that Rihanna's upper third is longer than her middle third and her lower third of the face. She also has some curvature of her forehead, which gives the illusion of added height. She has naturally arched eyebrows, with the peak of the arch being between the lateral limbus and the lateral canthus. Notice that her lateral canthus sits at a higher position compared to the medial canthus, from the side of the eye closer to the center of the head. This is a very natural orientation because of the way that the tears flow from the side of the eye towards the medial part of the eye and down into the nose. Notice Rihanna's long infrabrow segment. This is quite characteristic of her facial appearance. And she has that very nice supratarsal show on both eyes. In 2006, at the age of 18, notice that Rihanna's nasal bridge is relatively broad, as well as the nasal base. Her ala extend beyond the medial canthus. And while in some textbooks we learn that the lateral extent of the ala should line up with the medial canthus, you can see in Rihanna's case, it's quite beautiful even when you have that extension beyond the medial canthus more laterally. Rihanna has a short philtrum with defined philtral columns, and her cupid's bow is also nicely outlined. You can see here that Rihanna has excellent upper tooth show when she smiles, and she has a strong chin. In 2007, at the age of 19, what we see here is that Rihanna has quite a bit of upper lip arching. Remember that a lip lift surgery will accentuate this feature, and sometimes when we do lip lift surgery, to balance out the overall architecture of the upper lip, a corner lip lift might be advised to even out the contour of the upper lip so that you don't get as much roll-in of the skin laterally. Those are procedures that I will often sequence, with the lip lift happening first and then waiting at least 3 months to see if a person even needs a corner lip lift. If they do, then we might consider making those incisions out on the vermilion border. But most people end up doing great with the lip lift alone. Now, Rihanna already has that natural upper lip arch, so there's no reason for her to even consider a procedure like a lip lift because of that short philtral distance and that natural beautiful arch that she already has. Also notice that Rihanna's lower lip is fuller than her upper lip, which is a classic beauty feature. And again, when we do lip lift surgery, we're trying not to overemphasize the upper lip. So if someone has a finer bottom lip, we have to be careful not to disturb that balance between the upper and lower lips. In 2008, at the age of 20, we see that Rihanna's nasal tip has some rotation to it, and that fits with her upper lip shape. Especially from that 3/4 view, we see that nice alignment with the nasal tip and the upper lip being in harmony with one another. Also, we see that nice strong mandible. It's not just her chin, but it's also out to the gonial angle and the rest of the mandible that have some prominence to them. And that balances well with other elements of her face. In 2009, at the age of 21, I wanted to point out here Rihanna's M-shaped hairline. This is a very common configuration to a woman's hairline. Some women will have a more rounded type of appearance, while others will have a more M-shaped hairline. Like I mentioned earlier, Rihanna's curvature of her forehead starts quite low, and that again gives the illusion of having more forehead height. And from the profile view, we see that Rihanna has no real submental fullness, and that tells me that her hyoid bone is positioned relatively superior and posterior, and that strong bony definition is protective to some degree against some sagging that we sometimes see in the neck, especially as the aging process continues. In 2010, at the age of 22, let's again look at Rihanna's profile view, and let's assess for a minute her nasomental line. This is an imaginary line that connects the nasal tip to the chin, and as it passes through, you can see how it touches the upper and lower lips. And this again is just another signature sign of beauty. And we also see here that Rihanna's ear size is quite proportional to her face, where the top of her ear is on level with the brows and the top of the nose, and the bottom part of the ear by the lobule is on level with the base of her nose. In 2011, at the age of 23, let's take a minute to look at Rihanna's eyebrows. The head of the brow is starting medial to the medial canthus, which is a very natural starting position. You can see that the hair direction goes up at the head of the brow, and then it takes on a more fishbone type of organization. The length of the brow is classically between 5 and 6 centimeters, with the tail ending right around the lateral orbital rim. And as eyebrow hair transplant becomes more and more popular, understanding these proportions and these measurements is really important, especially how it references with the rest of the face to do the best possible eyebrow work. In 2012, at the age of 24, I see no change. In 2013, at the age of 25, when you look at these two pictures, it's an interesting comparison because in one, you see the full central height of her forehead, whereas in the other, with a certain hairstyle, it's now brushed over a portion of the forehead where it's coming down right up to where you have the flatter portion of the forehead. Beyond that, that curvature begins. So you have this comparison of Rihanna with the higher hairline and what she would look like with that lower hairline. Now that lowering is probably closer to 4 centimeters, so it's quite a big shift. But this is a good example that some hairstyles can mask a higher hairline. But she's clearly not ashamed of her beautiful forehead and often shows it off proudly. But for people who are looking for a temporary adjustment to their forehead without undergoing anything major like surgery, this is a great way to do it with just changing around your hairstyle to give yourself a different type of look. In 2014, at the age of 26, I want to point out here Rihanna's great sideburn hair. More and more women are losing their sideburn hair with facelift surgery, especially as facelifts are now being done on younger and younger patients. And I'm getting more and more requests for hair transplants to restore the sideburn hair. Sometimes it's because of facelift scars and people are looking to fill those scars with grafts of hair. But another reason is to actually restore the sideburn hair that's been removed with the facelift surgery. When I do that type of hair transplant, we're only using single hair grafts almost exclusively on the sideburns. That gives a more natural look. Similarly, at the hairline, for the first 2 rows approximately, we're often also using single hair grafts. That gives that more natural, lighter type of hairline look compared to the heavier, pluggier look of heavier grafts at the hairline. And that then leads to the most natural hair transplant results. In 2015, at the age of 27, I see no change, and that's the same through 2017. In 2018, at the age of 30, it looks like Rihanna has been using some microblading, maybe some makeup or tattoo for the lateral half of her eyebrows. You can see that distinct color difference, right? And all of these different treatments for cosmetically improving the eyebrows are still expensive, and they often require these recurring visits to maintain the look. And that's one of the reasons why I think a lot of people are turning to eyebrow hair transplant, because in many ways it's a one and done, in the sense that you get hair from the back of the head, and then as you implant into the eyebrows, the hair will continue to grow. It grows long and it requires trimming, but that's something you can do at home on your own and style it however you wish. So for some people that works better than continuing to do makeup or microblading, but for others they prefer a less invasive approach. So it's nice to just know your options as you're trying to decide how to best enhance and maintain your eyebrow hair. I also wanted to point out here that we all have natural face asymmetry. Notice that Rihanna's right side is her dominant side, and that's actually the case for most people. Just like most people are right-hand dominant, so what I've noticed in my practice is that the right side of our faces is also usually the larger side. Facial bones tend to be larger and wider on that side, and that's what we see with Rihanna as well. We celebrate these natural imperfections and these beauty traits over at my brand Feel Confident. Head to feelconfident.com to try out our incredible skincare and hair care products. And we recently got awarded Best in Class Thickening Shampoo for 2025 by GQ and Men's Health. Thank you so much for that honor. And thanks to all of you for supporting our brand. It means so much to me and to my entire team. We will hopefully be coming to a store near you soon. In 2019, at the age of 31, I see no change. And in 2020, at the age of 32, I also see no change. Rihanna recently had the following to say about plastic surgery. I want my pinned back to my shoulders, right where they used to be. I don't want implants, I just want a lift. But I don't want to ever have a tummy tuck because I don't want a new navel. And I don't want that scar. I'm also scared of the knife. She also had this to say about pregnancy-related cellulite. Third trimester cellulite is no joke. You just see ripples coming from places you never knew. And it's all in your thighs because your thighs are carrying the weight of your baby and uterus. Despite what countless products promise, most over-the-counter creams, oils, and devices have minimal, if any, proven long-term benefit for cellulite or stretch marks. These are complex skin conditions tied to genetics, hormones, and structural skin changes, not something a topical lotion can easily fix. While some treatments like microneedling, laser therapy, or radiofrequency may offer some modest improvements, there is no magic cure. Many marketed solutions exploit insecurity and push unrealistic expectations, especially for women in the public eye. While our Feel Confident products are great for everyday skincare, they're not intended for stretch marks or cellulite specifically. In 2021, at the age of 33, what we see is that Rihanna has increased facial fullness from pregnancy. You can see it particularly in her cheeks and the lips. And other facial changes are often seen with pregnancy. Increased water retention and weight gain can lead to a rounder, fuller appearance in the cheeks and jawline. Hormonal changes and increased blood volume can cause soft tissue swelling. Hormonal surges from estrogen and progesterone can trigger hyperpigmentation, often seen as brown or gray patches on the cheeks, forehead, and upper lip. This is sometimes referred to as pregnancy mask. A flushed or rosier complexion may result from increased blood flow and dilated capillaries. Some women experience more prominent facial fat pads during pregnancy, which may subtly alter the contour of the midface or the lower face. Fluid retention can lead to noticeable puffiness, especially around the eyes. Fluctuating hormone levels can lead to breakouts or changes in oil production, which may affect overall skin clarity and smoothness. In 2022, at the age of 34, I see no change. From 2023 to 2025, Rihanna's had the blessing of multiple pregnancies. And earlier this month at the Met Gala is when Rihanna revealed her third pregnancy. But compared to her photos from 13 years ago, we don't see too many changes to her facial anatomy. I see a slight upper lip contour difference, but this might just be attributed to makeup. As more and more people are getting cosmetic procedures, some quite invasive, it's refreshing to see the naturally aging face of Rihanna now in her late 30s. Based on my analysis, there are no clear signs of cosmetic procedures. It's a reminder that aging, when paired with good skincare, health habits, and confidence, can look beautiful. Rihanna's face tells a story not of resistance to time, but to living through it. In a world obsessed with chasing youth, she's a powerful example of how natural beauty, when left untouched, can still captivate. Do you agree with this analysis, or do you have a different take on Rihanna's facial evolution? Make sure to comment below and let me know which celebrity I should cover next. Thanks for watching.